United Nations Secretary General Antonio Guterres has called for $8 billion in funds to ensure a fair distribution of COVID-19 vaccinations across the world to tackle a pandemic that has killed more than 5 million people. Speaking at an event with the World Health Organization to launch a new global vaccination strategy, Mr. Guterres said the inequitable distribution of vaccines was dangerous because it could give rise to new variants and lead to more deaths. The UN Secretary General urged G20 leaders who are due to meet later this month to deliver on the desire to get the world vaccinated by stepping up with financial support. The new WHO strategy aims to ensure 40% of people in all countries are vaccinated by the end of this year and 70% of people by the middle of 2022.
Inequity. The development and approval of vaccines in record time took us to the summit of scientific achievement. Now we stand on the precipice of failure if we don't make the benefits of science available to all people in all countries right now. More than 6.4 billion vaccine doses have now been administered globally, and almost 1/3 of the world's population is fully vaccinated against COVID-19. But those numbers mask a horrifying inequity.
With vaccine production now at nearly 1.5 billion doses per month, we can reach 40% of people in all countries by year's end, if we can mobilize some $8 billion to ensure that distribution is equitable. Because crucially, the success of this plan requires equitable distribution. And without a coordinated, equitable approach, a reduction of cases in any one country will not be sustained over time. For everyone's sake, we must urgently bring all countries to a high level of vaccination coverage. G20 countries have frequently spoken of their desire to get the world vaccinated. Their meeting later this month will be an opportunity to deliver.
And when we look at what it will take, first of all, for those 56 countries to get to 10%, that's 200 million doses just to get the lagging countries that have not had adequate access to that supply. That's a week's worth of the global supply of the WHO EUL vaccines. If that can't be achieved, I think that there really needs to be a fine point put on that. The next is looking at getting to the 40%, and there are also already a substantial number of countries that are well over the 40% target. This is not about whether the world is making enough vaccine that is adequate to achieve that 40% target. It's about whether those doses are going to the places that most need those doses in order to achieve the target. So this is really a problem of distribution of the doses.